Hi guys, this is Dr. Wasim Khan from Your Family Doctor. Today I'll be talking about Jordan Peterson, who doesn't need an introduction for most people. He's a clinical psychologist and a professor of psychology in the University of Toronto, and he has over 3 million subscribers on YouTube. He started to receive widespread attention sometime in the late 2010 because of his views on political and cultural issues. He recently released a video regarding his long-term battle with benzodiazepine withdrawal due to treatment for anxiety. So let's just have a look at this for just a 1 minute clip from his video, and I'll discuss this a bit more in detail.
As some of you may know, but others will not, it's been a long while since I put up any new content on this YouTube channel. I've been suffering from impaired health, severely impaired health, as a consequence of benzodiazepine use for anxiety, or more accurately, from a combination of using that medication and then ceasing its use once I realized it was dangerous. That's put me in and out of hospitals for much of the last year in Connecticut, in the United States, in Toronto, in Canada, in Moscow, in Russia, and in Belgrade, Serbia, as my family searched for specialists who could aid me in the severe post-use withdrawal and neurological damage related consequences of both the benzodiazepine use and its cessation. I started
Okay, so that was just a 1 quick-minute clip of what Jordan Peterson has gone through. I'll discuss this more in detail now. So as Jordan Peterson mentioned in the video, he started taking benzodiazepine for anxiety, and when he stopped the medicines, even though he was taking the medicines according to the current clinical guidelines, after stopping it, he restarted to get withdrawal symptoms, which is a very common state or syndrome in patients that take benzodiazepines. He started taking this sometime in early 2017, and he describes trying to get help from places or medical centers in Toronto, going to Russia, Belgrade. And it's interesting that he mentions that what helped him to get through this was help with or support from his family and friends. Also his love for writing, which he mentions sort of later on in the video. So what are benzodiazepines? Benzodiazepines are a drug which was released sometime in the year 1959, and then they were known as minor tranquilizers. And the way they work is that they enhance or increase the effect of a certain chemical known as gamma-aminobutyric acid on the GABA-A receptor in the body, or especially the nervous system. So this slows down the nervous system. So as a result of this helps to reduce the levels of anxiety that one may experience. Some people also describe being in a trance-like state or a hypnotic state, and it also helps to reduce or relax the muscles in the body. In some people, it's used in patients that may be suffering with epilepsy or who may have suffered from a seizure. It can also be used in the treatment for this. So benzodiazepines are commonly used for 2 to 4 weeks as a short-term use for problems such as sleep problems or anxiety. However, they may be used for longer-term use for more than 4 weeks in patients who may have prolonged seizures or certain types of epilepsy, or in those that may be suffering from a terminal illness and need to be calmed down because of the anxiety they're experiencing, and in some patients who may be suffering from alcohol withdrawal. However, even use of more than 2 weeks can lead to one becoming dependent on the medicine, becoming tolerant to it, and as a result of this, withdrawing from the medicine as well. This is something which I'll describe in more detail now. So one of the main side effects of taking a drug such as benzodiazepine is that you can become dependent on this. So this is when you develop feelings of a strong desire or compulsion to take the drug, in this case benzodiazepines, and it can also become difficult to stop the drug. And when you do try to stop the drug, you develop withdrawal symptoms. The withdrawal symptoms can be associated with something called a tolerance. What this means is that you need to take more of the drug or an increased dose of the drug to feel the effects that you first felt when taking the lower doses. So you need to use a higher dose to feel the same effects when you first started taking the drug. The other thing that you see with dependence is that you start neglecting other interests, whether it's making YouTube videos, or whether it was cycling or spending time with your family or friends, and instead you occupy most of your time trying to get hold of benzodiazepines or the drug that you've become dependent on. So for those that are taking benzodiazepines, a time may come where they feel that the symptoms are better or they can stop taking the drug now. However, this can sometimes lead to withdrawal symptoms, and the symptoms of these include, the more common symptoms are an increased anxiety, feeling a tremor in the body, feeling that you're irritable all the time, feeling restless. You can also develop depression. You can also develop symptoms of dizziness, also sleep problems, nightmares, stomach pains. You can develop an increase in your heart rate or your pulse rate, and some people can develop a high blood pressure. More serious but rarer symptoms include seizures, feeling confused, but this is usually more common with an abrupt or a sudden stoppage of the drug. So in terms of managing this condition, the first thing is to speak to your GP, and ideally with one GP who you've got a regular contact with every 1 to 2 weeks, even if it means speaking to your GP or family doctor over the phone. The benefit of this is that you're always speaking to one doctor, so who you recognize, who you know, who knows your history. So for someone who's already been impacted psychologically, when you're speaking to one doctor, this will help to reduce your tension or your levels of anxiety and will help you to open up a bit more. The other useful thing that would help is to find some patient information leaflets on benzodiazepine withdrawal, dependence and withdrawal. This will often be provided by your family doctor or GP, although you can find this information on the internet. I will actually leave some links in the YouTube description below that you can have a look at if you're interested in this. So essentially, to help you to get off this medicine or the drug that's causing dependence, in this case which is benzodiazepine, your GP will help, but your GP will slowly reduce the dose or the amount of the drug that you've been taking, and this can take months to even a year or sometimes longer. So how this happens really depends on your individual circumstances and what your GP sees best fit for you. So for someone who may suffer from particularly high levels of anxiety before they go to sleep or before going to work or before they're giving a lecture, your GP with you may decide that it's okay to take a small amount of the drug or the benzodiazepine just to help you to relax during these times. But the goal is more of a long-term thing here. So it's okay to take a small dose of the drug just to help to lower your levels of anxiety, as long as we've got a long-term goal in mind to help you to get off this drug. So for those patients who completely want to stop benzodiazepines or the drug that is causing their problems, or to be on the least amount possible, in order to control the symptoms of whether it's sleep problems, anxiety, feeling a tremor, or stomach problems, they may be given other medicines by their GP to help to control these symptoms in the interim. So these may include propranolol, which is a beta blocker, which helps to slow down the heart rate, which also helps to reduce the tension, and can also, which you might describe as a muscle relaxant. Sometimes patients may experience sickness or diarrhea, so doctors can also give you some medicines which can help to control these symptoms as well. Interestingly, as Mr. Jordan Peterson described, one thing that helped to get him through was the support of his family and friends. So your GP will often advise that you speak to close family and friends who understand your condition and who can keep you occupied. The other interesting thing that Jordan Peterson mentioned was that his love for writing helped him to get through the withdrawal symptoms he was experiencing. So we often recommend that you also try to occupy yourself whether it's through your love of reading, writing, whatever it may be, and you'll often find that this will help to achieve that long-term goal that you're looking for. Okay guys, so that was just a quick run through of what benzodiazepine withdrawal is and how Jordan Peterson has suffered from this. Please leave any comments below of what you think about the video, and if you know anyone, or whether it's yourself who has ever suffered from benzodiazepine withdrawal and what you've done to overcome it. Please also leave any comments in the comments section below if you'd like me to talk about any medical problems that celebrities might be suffering with, or any drugs or medications, etc. Thank you.